We now have an electronic medical record at the hospital that we've been doing for almost a week. We've taught nurses and staff, most of whom had never touched a computer 2 months ago, to now manipulate it and order medicines, and we can keep track of stock and finances and patient statistics, and there's a lot of possibilities.
Okay, so this is the one of the corners of the administration building, and here we have a nano station that has a direct line of sight to one of the guest houses over here. So this is how we connect to the central part of the network back over there. This is the second access point for the main part of the hospital. We only have 2 access points, and it covers everything very well. So this one also has a direct cable back to the main switch. So it's a pretty long cable, but it's also powered over PoE, which is really nice. And this nano station here is what we're using to connect the Bland's house and the McDowell's house down kind of in the living area. And as you can see, if you look right down through here, there's really not a clear line of sight. There's several trees and branches, a big old mango tree down there, so you can't even see the other nano station. But despite all that, it's working good. This is where all the magic happens. This is the central hub of our network. This is our server room, consolidated into a nice closet. So here's our main server. Here we have, this is just a power strip that actually has a direct line to the batteries in the next building over. So this entire closet here theoretically would be online 24/7. Even if the generator goes off, then it's still running off the batteries. We have a PoE 8-port PoE switch. We have a router here that's doing DHCP. So we have several iPads here at the hospital, and we've been able to use them with doctors as they do their rounds. It's been very useful for them because here they can click on the inpatient list. They can see all of the patients in the different services. They can write progress notes, see prescriptions, prescribe medications, all wirelessly, all anywhere on the campus they can do that. And it's been working really well. We don't even have a completely separate skin or application on the iPad. It's all the same as it would be in the desktop environment, but it's been working very well so far. Okay, so this is called a carnet. This is basically the entire medical record for a patient that they have in this country. So the nurses and doctors, they write everything in this carnet. All the receipts are here. Kind of difficult to keep track of everything. So what we're doing now with this new system is they still keep the carnet, but now they get a number that is generated by the system, and then we write it on the front of the carnet, and then when they leave our hospital, they can just get a single printout with their entire treatment progress summary that they received at this hospital, so that when they go. Here we have a computer, and we've set all of our computers up so that when they turn on, they boot up straight to a web browser in full screen mode, so they can run the software just directly with no interruptions. One of the problems that we've had to face with here is that there hasn't been electricity hardly anywhere, so we had to run lots of wires in the roof and put in the outlets so that we actually have power to these laptops. In the past, we've had some problems with the stock levels for different pharmaceuticals because things will just run out, and then they have to order new things after they run out, and then you go this certain period of time without any medications. And so now with our computer system, we have a way of tracking the stock level and having it alert you when the stock level is below a certain point so that they know when they need to